be able to address you. So I was assigned to do the part on generic drugs for just this presentation. It's pretty clear that generic drugs are important just in the fiscal equation when you're thinking about budgets of any kind of insurer. They're now representing a majority of the prescriptions filled, so that also represents huge savings, and as Don pointed out this morning, those savings are one way that we capture a lot of the benefit from drugs. Except that, historically, we've had remarkably high retail prices for generic drugs in Canada. The reason for this is that generics, although the manufacturers are for many drugs very competitive, are competing for pharmacy shelf space by offering rebates to pharmacies. And you can call those rebates whatever you want, professional allowances, discounts, anything like this, and you can stop trying to pay them in Ontario, they'll be paid in Alberta. Those rebates are continuing to happen because that's how the manufacturers compete to sell their products. So banning rebates is simply not happening. Even if you have a notional ban, there are going to be ways to get around rebates because there's lots of money at stake. And in fact, as I've already mentioned, some provinces have simply not prohibited them. So if you've got national companies with national pharmaceutical chains, banning rebates in Ontario is useless. And even the courts seem to find something like that. The rebates, however, have been an important source of pharmacy income. The reason that we've had such high retail prices is that pharmacies haven't had to compete for market share by setting low prices. So even if they can acquire drugs at relatively low prices, they don't really need to offer them at low prices to consumers who are insured. In some cases, you'll see them waiving a copayment or that sort of thing. Or they might offer to eliminate the, for example, the dispensing fee. And they can do this because they're making so much money on essentially buying the generic product and then selling it at a high price. Patients are insulated from real prices by insurance, which is really good. We don't want to stop them from being insured. But the effect of that is that there isn't effective competition at the retail level. It's also resulted in there being potentially excessive profits per transaction. And of course, if you have lots of profits per transaction, then you're going to draw new entrants into the industry. So the result of that is you get lots of pharmacies. Having lots of pharmacies means you drive down the profits per pharmacy because they don't have so many transactions. And eventually you end up with high average costs at the pharmacy level. So the system that we have is driving inefficiency in pharmacies. Now, it may also be driving high levels of patient service, because one way you can compete for patients, of course, is to provide high levels of service. So there's a balance there. But it's likely that you're also getting high average costs at the pharmacy level through an excessive number of pharmacies. Okay, I did write this intentionally. Governments have created this monstrous outcome by setting arbitrary prices that they're willing to pay. There's absolutely no sense in the system that we have currently. Governments across the country are setting arbitrary prices for generic pharmaceuticals based on the price of the branded product. So, Ontario is reducing it to 25%. It used to be 75%, and then it was 50%. Now it's 25%. You notice a bit of a pattern there. It's sort of round numbers, which have nothing to do with the cost of the generic pharmaceutical manufacturing process? Absolutely nothing. Right? These are taken completely arbitrarily because they sound like, I don't know what the appeal of round numbers is. I think they would have been much more credible if they'd said it's going to be 24.3%. Then we would have said, they've done some calculation. So for many generic drugs, the prices are far too high, even at 25%. It's pretty clear that the manufacturing costs for many generic drugs, and you can just look at international prices, are on the order of sort of 1 to 2% of the branded reimbursement price. Wow, why are we paying 25 times the cost? Something's wrong with that, yes? And this is what, of course, leads to the rebates. For other products, the prices are going to be too low if you set it at 25%. Of course, because it's arbitrary. It's like the government saying, a subcompact car has to be priced at 30% of a Benz. It's the same logic. Right? And if the government did that, you say, boy, that's really stupid. So what are we doing in the pharmaceutical sector that we think that is reasonable just to say, whatever the brand price was, we're going to choose an arbitrarily fixed percentage for that generic product? The result of this is that all products are going to be priced wrong. So here's a few choices to fix this problem. So choice one, which I've presented to you in not very complimentary terms, is arbitrary prices. And I'm not complimentary because I just can't see any plausible rationale for this system. A second system is a tender system, and a third would be some kind of structured competition. So let's talk about those briefly. A tender system is a system in which companies are encouraged to compete for the entire market. So in which a provincial insurer, for example, or a group of insurers would offer to a company to offer to all generic companies to compete for the market and offer the entire market to the company that offered the lowest price. This is pretty effective at price reduction, at least initially, because companies recognize that if they're going to compete, they have to offer their best price. However, it does tend to reduce the number of participants in the industry, since the firms that don't win the tender aren't going to be producing that product. Next time the tender comes up for renewal, they haven't been producing, and it's much less attractive for them to continue to maintain the expertise and the manufacturing capacity for those products. And that in turn has the risk of leading to higher eventual prices, or also, as we're seeing in many markets, to shortages for the drug if the single supplier isn't up to keeping the product alive. And you can see that if you have a product which is being sold at extremely low prices, where there really isn't much of a profit to be made, the manufacturer doesn't really have that much of an incentive to continue to ship the product. The other danger with tenders is that it's really not appropriate for use immediately upon generic entry. So if you issue a tender immediately upon generic entry, you're at risk of seeing that the firms that actually made the investment to genericize the product end up not getting a share of the market. And the risk that comes out of that is that firms are just going to say, well, I'm not going to bother doing the litigation to compete in this market. And we've seen repeatedly in Canada where there have been tenders that immediately upon generic entry that actually the brand supplier that was supplying before and that litigated in order to prevent generic entry, immediately following generic entry, then takes over the entire market. And the generic firms that engaged in the litigation get not 1 cent. This is not a recipe, of course, for encouraging generic firms to try to compete to enter the market. So the third option that I'm proposing to you is one that's really based on what Ontario used to have. Ontario had for a long time a system with 70% pricing, and then when a second generic entered, it'd be 63% pricing based on the branded product. Why they stopped there, I don't really understand. The benefit to this kind of a system is that generic firms enter as long as the prices are above their cost of production. So if you structure it so that every time a generic firm enters, the price is required to drop, the price for everyone is required to drop, then firms will, as they enter, lead to an efficient reduction in prices for consumers. And effectively what happens is that you use the private information of generic firms concerning their own costs of manufacture to help set the price. So if it's an expensive product to manufacture, you're going to end up with relatively high generic prices. If it's a cheap product to manufacture, for example, if it's going to be a product like amlodipine or something where the cost of manufacture is a tiny share of the branded price and lots of firms want to get into the market, you're going to see prices being brought down far below 25%. You can use this kind of system immediately upon genericization. You don't need to worry about whether the generic firms are going to have a chance to participate. And there's no objection here to any kind of participation by the brand's authorized generic, which otherwise is kind of awkward in a tender system. So this is just a system for that offers a mechanism for actually relating prices to the costs of production, and it's what we don't have right now in Canada. So we've proposed in our paper that some provinces should try experimenting with this. It doesn't need to be on every product, but why not try on a few products? The second point that I wanted to highlight from the paper is one that Jody's already brought up. The notice of compliance regulations with respect to the way that they lead to the interaction between generics and brands is, I think, arguably broken. There is just enormous litigation in our system. So you've, although Paul didn't quote it this morning, you've maybe heard the number that each new drug costs $800 million to produce. Apotex has a report, I don't know, a statement recently, and you can make what you want of it, that over the past 10 years, they've spent $800 million on litigation. We're spending huge amounts of money on litigation. If Apotex is spending all that money on litigation, the rest of the generic industry is also spending that kind of money on litigation, at least collectively. And the brand industry has to be spending, well, whatever the generic industry collectively is spending and much more. We're talking billions and billions and billions of dollars. There's something wrong with that. That's not what we should be spending our valued drug, health dollars on. And unfortunately, the way that the system is structured is really incentivizing brand firms to use patents to keep out generic entrants and it's incentivizing generic entrants to challenge those patents. Well, if you spend billions of dollars out of your limited resources on litigation, that money's not going to innovation. It's not resulting in savings for consumers. This is all bad. So we really want a simplified system that rewards innovation, that doesn't reward it excessively, and that provides fair rewards across different products. The NOC system just seems designed not to do that. Now, it's pretty clear that the interaction of the notice of compliance system with patents and data exclusivity is really complicated. It's also unique to Canada. Right? Nowhere else has our system. We might do better with something more like the US system, where there's essentially just a single court case, or that's probably not quite fair, but you don't have a review under the NOC system and then also a separate review under patents as we do in Canada. I think it would be really worth looking at the possibilities of having a longer, a more comprehensive data exclusivity system, and maybe no notice of compliance barrier which is linked to patent status. And that would be the kind of trade-off that potentially everyone could benefit from, branded and generic industries, not the lawyers. It's really time to revisit this system. And it's time to revisit it in the context of a comprehensive review of how these essentially three mechanisms that we have for protecting patented innovations operate. There's actually a few more suggestions in the paper. I'm not going to get into all of them, but I do thank you for your attention.